This is In the Loop. I'm Christian Bryant. This show is your one-stop shop for deep dives and solid reporting. Not sure about the host, but the rest of the show is great. Here's what we got for y'all tonight. The COVID pandemic has been an emotional roller coaster for some of us. One minute you're feeling safe, maybe even safe enough to pull off the mask for a moment and take a big deep breath in public. The next minute you're hearing about a new variant. People close to you are testing positive, and some of the people who get sick experience long COVID. So what do? You re-up on hand sanitizer, purchase toilet paper in bulk, and start digitizing those previously in-person group events. Sound familiar? With more than 1.3 million new COVID cases reported Monday, it's clear Omicron is continuing to spread across the country. And because of that, many people have taken steps back when it comes to resuming certain activities. Even though it seems to be milder than other variants, there is still the possibility of long COVID, something we still don't know much about, including what makes one person more likely to get it or how best to treat it. National correspondent Maya Rodriguez helps break all of this down for us by talking to experts about Omicron and what this variant could mean for long COVID.
Our vaccines, especially when combined with our boosters, have remained extremely effective at keeping people out of the hospital.
But still, since Omicron began spreading in the U.S. over the holiday season, there have been millions of new COVID infections.
This Omicron variant is more transmissible than previous versions.
Dr. Bruce Y. Lee is a professor at the City University of New York Graduate School of Public Health and Health Policy. He's been studying and tracking COVID since the pandemic began.
Based on the data, it looks like the peak of this current Omicron wave will probably occur sometime in mid-January.
By then, millions more Americans could potentially be infected with COVID. But it's what happens in the months after those infections that will need to be looked at closely, including what Omicron might mean in terms of new long-haul COVID cases.
Long COVID is something that's many times overlooked and not discussed. People are focusing on things like deaths or potentially hospitalizations. Many people tend to forget there is a significant percentage of people who are suffering from long COVID.
Dr. Lee says with previous variants, there's been some correlation between how severe a COVID case is and how likely that person will become a long hauler. But
this is not a super strong correlation, meaning that there have been many cases of people having milder symptoms or milder COVID-19 early on, but they continue to have persistent symptoms.
Those can run the gamut, including a loss of taste or smell, muscle pains, and brain fog, among others. The World Health Organization defines long COVID as having symptoms more than 3 months after an initial infection, a timeline we haven't reached yet with Omicron.
It's not clear what percentage of people who've been infected with the Omicron variant will develop these persistent long COVID symptoms versus other variants.
And something that, for Omicron cases, might not become clearer until the spring. I'm Maya Rodriguez.
All right, many thanks for that, Maya. Now we're going to take a look outside the US, where Omicron is continuing to spread across many countries that have much lower vaccination rates. Here to tell us more is Newsy's health and science correspondent, Lindsay Thies. Lindsay, can you paint a picture of how Omicron is impacting communities outside the US?
Hey Christian, I wish I had better news here, but with Omicron, just like the United States, many countries around the world are seeing their COVID case numbers just explode. Tuesday, Israel reported an all-time record of 37,000 new cases so far. 3 Chinese cities have locked down because of the recent COVID cases there, and they have the Winter Olympics looming, right? So in total there, 20 million people impacted. India has started giving booster doses to healthcare and frontline workers, along with people who are above the age of 60 or might have some underlying health conditions, because cases in India have increased 8-fold in just a week. And in Europe, cases have doubled in a 2-week span. Today, the World Health Organization is warning that half of the population in Western Europe will be infected with COVID-19 in the next 6 to 8 weeks.
Because of the unprecedented scale of transmission, we are now seeing rising COVID-19 hospitalizations. It is challenging health systems and service delivery in many countries where Omicron has spread at speed and threatens to overwhelm in many more.
The WHO continues to plead with rich countries to donate extra doses to those poorer countries where vulnerable groups have yet to be immunized. Instead of those richer countries offering booster doses to its citizens, the WHO European director says that he is greatly concerned that as Omicron moves east across the continent of Europe, countries with lower vaccination coverage rates will be hurt the most. Christian?
All right, many thanks for that global perspective, Lindsay. The latest models suggest Omicron will peak in the US between January 19th and the 27th. Cities like New York, who were the hardest hit early last month, will peak first. Another question that's been on a lot of minds as we enter what some are calling junior year of this pandemic: how does it end? While there are some promising signs about what's to come in the future, one way to gauge the length of a pandemic is to look back to the past. Our partners at the Washington Post video team bring us this next story about what history tells us about the end of pandemics.
The coronavirus pandemic, as we now know it, will eventually end, but not in the way you might think. History offers important lessons.
The only epidemic or infectious disease that has ended biologically is smallpox. And so there is very little precedent in how something ends biologically.
You follow the late phases of the smallpox eradication program, which focused intense surveillance and policing.
The question was asked over and over again, have you seen anyone who looks like this?
There's a bit of a hubris that takes place in the field of biomedicine, this notion that all infectious diseases could ultimately be conquered.
Usually, viruses don't go away. Strains of the seasonal flu, for example, are descendants of the 1918 influenza pandemic.
Well, of course, there was no vaccine for anyone in 1918. The pandemic, I think, ended really when the vast majority of the population was exposed to the virus and the immune system became capable of dealing with the virus.
This is part of the basis of moving towards calculations of herd immunity. We're at a moment in which 60 to 80% of the American population has been vaccinated or has otherwise acquired immunity against COVID, and the epidemic has not ended. We are now experiencing some of the limitations of a vaccine-centric public health response.
The kind of global inequalities that are coded into the global health structure, that it takes years for a vaccine to really be an efficient way of managing an epidemic.
It's not surprising that we see new variants.
Tonight, the Delta variant fueling an alarming rise in cases across this country.
A troubling new variant of the virus. But what happens globally will impact us. So if we get more people vaccinated globally and more people vaccinated now, hopefully within a reasonable period of time, we will get to that point where it might occasionally be up and down in the background, but it won't dominate us the way it's doing right now.
Experts say COVID-19 will likely transition into an endemic disease, existing permanently in a population like the measles, chickenpox, or HIV.
The analogy I would make here is that as HIV moved from a death sentence to a treatable chronic condition, it became more like diabetes, another endemic disease that we simply think of as part of everyday life and can be managed with proper resources.
Historians also say epidemics end when they disappear from public consciousness, but that doesn't mean the threat is gone.
The history of prior pandemics teaches us that once a disease is no longer considered to be a concern or a risk for an affluent or mainstream or middle class, that it can disappear from view.
So that's one of the ways that epidemics end. We don't think about them anymore.
The Ebola pandemic, once that pandemic was declared over,
NGOs and international aid pulls out of regions that are still very much struggling with the disease.
As soon as there is a declaration that this pandemic is over, we need to ask, over for whom?
COVID theoretically could turn into a disease that's not a problem in places that have adequate health infrastructure and access to healthcare, but would be still continue to be a problem in other places. So the people with long COVID, the people who have lost family members, friends, and so on, who will continue to live with that loss. So I think we need to be very careful when we're thinking about that ending, to make space for these various problems and various ways that the epidemic lives on.